Hello, my name is Vicky Sarkert and I'm a practice development nurse here in critical care at NUH. And I've got my colleague just out of sight here, Sarah Johnson, and Jacqueline Richardson, our Deputy Divisional Nurse, and Helena Durham, who's our Patient Public Representative, both send their apologies. So we're here to talk to you today about a great piece of work we've done in critical care, and that's I will always be familiar with the AICU area and environment, and that's through the introduction of an orientation checklist into the adult intensive care unit. Next slide, please. So this work was done in collaboration with NHS England, Always Events, and through co-production and co-design following quality service improvement methodology, we look to ensure an optimal patient experience towards time. So Always Events are, as it's described there, the aspects of the patient and family experience that should always occur when patients interact with healthcare professionals and the delivery system. Next slide, please. So just a bit of background about critical care here at NUH. So fairly large campus, major trauma centre, and we've got 3 critical care areas split between the 2 campuses. And for the purpose of carrying out Always Events, we decided to focus on the adult intensive care unit. And the reason for that is that we identified that from a communication perspective, particularly communicating with patients, it can be really challenging. And we just didn't want this patient group, I guess, not to be represented for those reasons. Next slide, please. So the challenges are the communication barriers, obviously the complexity of patients, and it is a real roller coaster for patients and families because obviously it is a very stressful time. So the risks of not really trying this quality improvement methodology is that we wouldn't be exploring patient needs, and that could really lead to a poor patient experience, and we're not challenging our own practices. So it is a driver for change, and our trust strategy is for obviously for patient and public involvement. And here at NUH, we have been on the Magnet journey, and a part of our Magnet accreditation that we're hoping to achieve is that we deliver outstanding patient experiences. So this was a great opportunity to improve patient experience and really relook at how we work and our priorities, and introduce quality service improvement methodology across our workforce, and obviously then look at sharing and spreading innovation. So the team, we had an oversight team, which was quite a high level team of our deputy chief nurse and other key stakeholders. And then we had our implementation team. And this team were very much multidisciplinary, who were at the point of care for patients. And highlighted there is our patient public representative, who was absolutely instrumental and pivotal to all this, and as always gave us really great advice and guidance. And as a team, we came together every month and discussed what our vision was, what our strategy was, and as we were exploring our Always Events, brought it all together as a team. And also we had monthly coaching calls with NHS England, who again were really, really great in advising us and guiding us. Next slide, please. So we didn't really know where we were going with this when we first started, and I guess that is the beauty of Always Events, that you're not quite sure where it's going to take you. So we started off with the first scoping exercise, and that was really to try and encourage our staff at the point of care to have those conversations, have that dialogue with patients as able, and with families, to really try and find out what we could do better for them. Really what can we do better, and really try and explore that. So as you can see, from the scoping exercise, we had different themes that came forward. So again, we went on to a second scoping exercise to really try and pick away at those themes. So the next slide, please. And this was all done following a PDSA cycle. So we started in the scoping exercise to explore those themes further and start to ask more pertinent questions. And what we're finding is that we weren't always very good at introducing ourselves, and our patients and families couldn't always remember our names. So we were great initially at saying hello, my name is, but then we wouldn't readdress that, and at that time our name was on a lanyard, and that would be difficult to see. So a quick fix from this, which wasn't our always event, is that we introduced this yellow name badge, which I know many trusts have introduced, but again, a very simple, effective, quick fix, which we did co-produce and co-design with our patients and families. So next slide, please. So under the advice of NHS England, we talked through the sort of communication themes that were coming through, and what we did as a team, we were aware that we had a carers policy within the trust, which looked at, for example, how we orientate carers to the areas within the trust. So we looked at the NUH carers policy and had a look, is this something that we could tailor and introduce into the adult intensive care unit and then across other critical care units? Next slide, please. So to further capture a baseline of the communication themes, what we did, we introduced an audit, and we were hoping to capture 25, obviously as many patients as possible. We managed to capture 28, and that was 5 patients, and the rest were patients' families. And again, what we started to do were ask those questions. Are you able to say your nurses today? Have you received a critical care information booklet? And that's got a wealth of information in there. You know, for example, telephone numbers, guidance about where to get something to eat and drink, car parking. Are you aware of visiting and that we do provide flexible visiting? Has anyone explained the bedside equipment to you and the area in general? Has the About Me document been completed, which is more personal information about that patient? And have you been invited to ask questions today? And do you know how to arrange to speak to a doctor? And I know this is all really basic things, and obviously it's something that we should be doing day in, day out. But actually, when we really started to explore this, it wasn't consistently being done by our staff for our patients and families. Next slide. So this was the data that we captured from that audit, and as you can see, as we go through, where we really start to fall down is around, again, that environment, the bedside equipment, aware of visiting and flexible visiting, about the critical care information booklet not always being given, and the About Me document not always being completed. So it did identify that we had some work to do. Next slide. And these are some of the messages that came out from patients and families, and we know that these stories are always really powerful. And I think one of the ones that really jumps out for me is when a patient says, "I'm sorry, but I can't remember your name." And we don't want to have patients to have to apologise, particularly if there are the things that we can put in place to help. So our pledge, our vision statement was, we will always support you in being familiar with the AICU area environment. And our aim statement was, by April 2019, 90% of patients as able and or next of kin on the AICU will have received an orientation to the area environment utilising the checklist. So we co-designed this with our patients and our relatives, our families. And the idea of this is that it is completed within the first 12 hours of admission. And then we revisit it after 24 hours, and that just again gives us that assurance that if it hasn't been delivered in the first 12 hours, but also us having that understanding that it is an extremely stressful time in that first initial time of admission. So it just helps to go back, revisit it, have those conversations, and hopefully to embed and make sure that information is being passed on. Next slide. So we had to look at obviously if we had compliance of this. So a compliance audit was carried out monthly to check if the if the orientation form was being consistently carried out. Next slide. So we carried this out March, April, May, and then we did 2 further assurance audits in the September, and then following on. And what we were able to, what we did find is that we were we were meeting our aim statement that 90% of our patients or families were receiving that orientation. So we do have plans to do another assurance audit of this, again, just to make sure it is in practice. But obviously at the moment with visiting, we're not able to do that. But I think, so next slide, please. So I think the great thing about the Always events, and obviously how our services have changed recently, is that we have this methodology in place. We've utilised it once, and so we're a lot more comfortable with it. And I think we all need to rethink where we're going, especially into this winter and following COVID. So we really are, as a team, looking forward to introducing our next Always event.